stormy. Then I depend on you to prepare a table before me. Baba, take me away from this wilderness. Protect me from the things them. Why you say that they give and stress? This year my life was sweet. I'm tired with this bitterness. I must make this money. I beg you, Baba, make you give access. Boy, I pray for me. Mama, pray for me. I'm in the jungle. I want to make money. Boy, I pray for me. Papa, pray for me. Oh no, I guide my footsteps in this journey. Boy, I pray for me. Boy, I pray for me. Mama, pray for me. I'm in the jungle. I want to make money. Boy, I pray for me. Papa, pray for me. Oh no, I guide my footsteps in this journey. Boy, I pray for me. Oh, God bless me as I am taking this journey. The road to success, that is something we found. Sometimes you go get level, sometimes you go stormy. Then I depend on you to prepare a table before me. Baba, take me away from this wilderness. Protect me from the things that why you say that they give and stress. This year my life was sweet. I'm tired with this bitterness. I must make this money. I beg you, Baba, make you give access. Boy, I pray for me. Mama, pray for me. I'm in the jungle. I want to make money. Boy, I pray for me. Papa, pray for me. Oh no, I guide my footsteps in this journey. Boy, I pray for me. As I am going out, Baba, please bless my hustle. Give me the courage to move on. Skanking my muscle. As you can see this show, it don't tell me how it's struggle. I am portion of blessing, I beg and you give me a double. Baba, take me away from this wilderness. Protect me from the things them. Why you say that they give and stress? This year my life was sweet. I'm tired with this bitterness. I must make this money. I beg you, Baba, make you give access. Boy, I pray for me. Mama, pray for me. I'm in the jungle. I want to make money. Boy, I pray for me. Papa, pray for me. Oh no, I guide my footsteps in this journey. Boy, I pray for me. Oh Lord, bless me as I am taking this journey. The road to success, that is something we found. on me. When I depend on you, so prepare a table before me. Baba, take me away from this wilderness. Protect me from the things then. Why you say that they give my skins? This year my life no sweet. I'm tired with this bitterness. I must make this money. I beg you, Baba, make you give access. Boy, I pray for me. Mama, pray for me. I'm in the jungle. I want to make money. Boy, I pray for me. Papa, pray for me. Oh, no, I guide my footsteps in this journey. Boy, I pray for me. Pray, 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 if you having credit problems, I feel bad for you, son. 1,000 problems, but it can't rank one. Words for sure, got me back in the car. Listen, with my credit, I was like, oh man, forget it. Who would have thought I'd be accepted and more? But now I got the keys, I feel so pleased. All types of cars, Benz, Minis, Reynolds, you know, boom, boom, let's go. Words for sure, car leasing for every credit score.
Yeah, I've won 3 times now.
Wow, is that all through Lifestyle Bids, right?
That's right. So first I won the Music Awards, which was in London. Then I won the boxing match, which was in Cardiff. All you had to do was bid 83 pence for that. And then the music festival, which was in California.
And the private jet?
Yeah, me and Fumi from that too.
So I think it's definitely safe to say that Lifestyle Bids works for you.
Oh yeah, Lifestyle Bids definitely works for me.
So don't just dream it, bid it. Go to lifestylebids.com and let the adventure begin.
That's your baby.
It's 2 weeks on the business.
And where I'm from, top of dawn. I get that money, hit the city, then I'm gone. And we legit, we hella lit. Represent who you with. And where I'm from, top of dawn. I get that money, hit the city, then I'm gone. And we legit, we hella lit. Represent who you with. Hey yo, if you ain't hit Africa for real, where is that? Queen of my queendom, you already know that's the fact. Free talk the guineas and men just to be exact. Keep a couple million full of bands, got me by the stack. Don't check for me, cause you ain't gonna find me. Gotta check for me, yeah, that money won't buy me. 8 days low, so you better not try me. Bit the class, bit the size, hold like a grind. I this style, I hear they say I'm pretty. Drop it low, I am physically fit. So much love I put on for my city. Make them know me not born free from titty. I got the goons and I got the caddies with me. I love the vibe and I like the way it fits me. Can talk but bro, I like the way it fits me. 3 times where I'm at, you know what I mean? Where I'm from, 3 times the dawn. I get that money, hit the city, then I'm gone. Born as a leader, some boy, I'm a leader.
Big nation, the OC, we are leader. We stay leader, no man, no follow. We pay for me breakfast, lunch, for me dinner.
You are leader, don't got a leader. Big nation, the OC, we are leader. No follow no girl, no follow no man. We are African royalty and a rough man.
I'm a PSL, call me no follow. Fresh and clean, HD on the camera. 5-star general, answer to the spring of Shiva. While I see me human, they can't bring me down, cause you can't see me down. All I see is sky, if you watch for the sky. Step on top, the most on track. Serious star, shine from down. Queen come from the melody, me and the bitches follow me. Hotter than fire, you don't wanna get the hell away. And still proud of me, and turn out the bother me. On the way up, catch flights and follow me. You're leader, stop boy, you're leader. Big nation, the OC, we are leader. We still leader, no man, we no follow. We pay for me breakfast, lunch, for me dinner.
You are leader, don't got a leader. Big nation, the OC, we are leader. No follow no girl, no follow no man. We are African royalty and a rough man.
Tunashiriki vyema wantu jenzi na tena tunajituma hata kulia tunaweza option tunaweza maneno tunaweza mchipunguza tunaweza udakitari baba pasikari dada
Superwoman, 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 superwoman.
Keep tabs on the resources your
Hello, hello, hello. Good evening, good evening, good evening, ladies and gentlemen. Welcome back to the Health Show. This is Isatta Sisay-Jalloh on the Health Show, live on Diaspora Voices. It's been a while. It's been quite a while, over at least eight weeks. Being caught up with the coronavirus, the COVID-19 rapid response team, so much so that the Health Show had to, take the back foot. But a lot of people have been texting me and calling me and saying, what's happening? What's happening? What's happening with the Health Show? Why are you not going on? And so on and so forth. It's just been too much to do all at once, The Sierra Leone COVID-19 rapid response team has took over my life for the last 14 weeks. And of course, on top of that, I am still working.
I am quite senior in my job, working with COVID, supporting other healthcare professionals with COVID, and so on and so forth. So it was too much. So something had to give, and two things gave. It was the health show, as well as some of my family time and my privacy. Those are the things that gave way. So today we're going to talk about, I thought let's break into the program again by acknowledging what's still going on in our community and across the globe, as well as what has always been my bread and butter, cancer, and how they link in, and what the current situation is. Because since this devastating pandemic of coronavirus 19, which is, as we know, is part of a group of viruses that affect the respiratory system, since it turns our life upside down from, I would say, we started realizing it since end of January, but it really hit the peak by March, April. Since then, it has also had an unprecedented effect on cancer. Cancer has suffered a lot because of the COVID-19. When I say cancer has suffered, not the disease, but people who are suffering from it, people who should be diagnosed of it, and people who are receiving treatment. They've all suffered, and that is why I thought, let's talk about it a little bit. Let's talk about the impact it's had, and just also to remind people what they should be doing and what they should continue doing during such times, so that as much as the NHS England or the whole world and the government are trying to get us back into this new norm, it's very important for us to think about what we can do as individuals. Yes, for the last 12 or so weeks, we've been told about fitness and physical exercise at home and so on and so forth. But what we've not been hearing too much about is, how do we do our self-health check at a time when you cannot visit your GP surgery, your GP cannot do a home visit. When you call 111, you have to have a serious reason, let alone when you call 999. So it's very, very important we look at some of these things and see how best we could do what we can do within our own homes, and how best we can support other people as well around us. So good evening to everyone. Good evening. I could see Aminata Kalon. Good evening, sister Zaina Bangura, all the way from US, Emma Parker, Auntie Harriet, big sister, Divam, Nima, and you know, and Avril, the Mamina Power, Rose Benda, Auntie Betty, Mercy, and so on and so forth, Sierra Jen Media, and so on. Lots of people on. Welcome and thank you. It's lovely to be here again, and it's lovely to be of service to you. And it's all about, let us learn and talk and share. You know, we talk about things, we learn about what we don't know and what we knew, but we just reiterate it or refresh our memories. And then we absorb that information, but at the same time, we're able to share that information or knowledge or whatever it is. So please feel free to drop down comments, to make contributions. I like it always to be interactive. And if you want to call, the number is there. Please feel free to do so we can have a chat. So for me, like I said, Corona has had a significant impact on cancer, primarily so majority of the screening. The screening process of cancer has been put to a halt since this coronavirus. Around 2.1 million people in the United Kingdom and Scotland and Wales are waiting for breast, bowel, and cervical screening. Those are the three main screening programs that has been affected. And the reason why these screening programs are important is because with these screening programs, there is the theme of, or the mantra of, early detection saves lives. So the earlier they can detect any of these cancers, the easier it is to treat it, the quicker it is to treat it, and the better your outcome in terms of your survival and so on and so forth. That is why NHS England and the entire England and Wales really did put a lot of effort into these screening programs. Unfortunately, COVID-19 came and then put a halt to it, which has kind of turned everything around. So for the time being, as of now, as far as we are aware, screening services has been formally paused in Scotland, Wales, Northern Ireland due to this COVID, and effectively, of course, in England. And what does that mean? Usually people who have reached or are approaching the age of screening, they usually receive a letter to tell them that, you know what, you're due this screening, you're invited to either a mammogram or a bowel screening or a cervical screening, which is a smear test. But all of that has been paused. So you're not receiving any letters, and you're not going to receive any letters for a while. They don't know when they're going to start doing that. And there is reported statistics that says for every week that screening is paused, 7,000 people aren't being referred for further tests, and 380 cancers aren't being diagnosed through screening programs. So usually they're saying, with the way how effective the screening program was, even though they were still asking for more and more and reminding people to go for their screening, especially, I remember last year and early this year, they were banging on about cervical screening. The stats really went down as to people who were going for their smear test. So ideally, 7,000 people should have gone through screening who would have been referred for further investigations. And out of those, 380 cancers would have been diagnosed. So can you imagine? I really want you to think of the figures. Think of the figures and think about it really well. The impact this is going to have, especially with the backlog in screening, and the potential impact is going to have on survival. As we know, a majority of us are already frightened by that word being mentioned, that word cancer. The mentioning of it alone, some people think it's already a death sentence. Now, there is a projection that actually a lot of those cancers they would have been able to treat and identify in the early stages are not going to be identified because of the halt in the screening. So that is really, 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 really difficult, really, really difficult. So there's a significant drop in the number of urgent referrals. As you know, if you don't know, cancer is one of the diseases that has special policies in place, which one of them is a 2-week rule policy. So you go through a screening, or you go to your GP, you suspect some signs of cancer, or you don't know it's cancer, you just suspect some changes or symptoms that you take to your GP. Your GP straight away picks that up and they refer you straight away to an oncology center under the 2-week rule. So under 2 weeks, you're seen, tests are being done, and within 6 weeks, you're having treatment. So all of that 2-week wait figure has been affected, with 250,000 fewer people being referred for further tests and everything. And that's because people are not going to their GPs anymore. People are not going. People are not calling. People are not, just because they're not identifying the symptoms, but actually some people have been identifying the symptoms, but they've been put on hold due to the risk of COVID being spread, but also people who are at home, they identify some of these symptoms, they're frightened. They're frightened to death to go into hospital because they're worried that if I don't have COVID already, I might have COVID now if I go into hospital. So those are some of the things that has been affecting people a lot. And like I said, the urgent referrals have dropped. It has dropped around 25% at the same time of the usual levels in England. And it is extremely, extremely worrying. For me personally, it is worrying because even under normal circumstances, our people, the BAME community, are not very good at identifying these issues on their own. And when they do, and if they do, they are not very good at taking themselves to the doctor to say, I'm a bit worried about this. I feel a lump in my breast, or I saw blood in my stool, or I'm having intermittent passing of urine, you know, or I generally don't feel well, or I've just lost weight significantly recently, just drastically. We're not very good at that. So let alone under these extreme circumstances. And that is why I felt I needed to do this program, so that just to remind you all that cancer is still there and it's looming and it's being treated, and you need to be a bit more vigilant. Yes, it's had a very big blow in terms of this pandemic, but things are beginning to come together. The cancer community, as in the cancer health professionals, are all working very, very hard at the moment, including the private sector, to see how best they can put things back into place, and so that things can come to as normal as possible, as quickly as possible. And they're also been working very hard as well to bring back the confidence in people, so that they can feel safe to go to their GP, they can feel safe to go for their outpatients appointment, they can feel safe to go for further investigations, especially screening, which has been affected quite a lot. Now, the other thing that has been affected is treatment. Of course, if you don't have your screening, you're highly likely not to be diagnosed. If you don't pick up the symptoms, and if you do, you pick them up, you don't go to your doctor, or you don't call for help, you're highly unlikely going to be diagnosed. But for those who have already been diagnosed pre-COVID and we're having treatment, this has also affected a huge amount of people. Around 12,750 people are waiting for their cancer surgery. Just surgery alone. People who have been diagnosed of cancer, and they have had multidisciplinary team meetings, and they've agreed on a treatment plan. And the treatment plan, for some of them, their first treatment option was going to be surgery. But now they could not have that surgery. They're waiting for that surgery. Just think about what that means. Not what just it means on the physical health, but what it means on the psychological well-being of that person. It is already difficult as it is. You're already being told you've got a life-threatening or life-limiting illness such as cancer. And then they've given you that hope and heads up to say, well, we can treat it, and we're going to offer you surgery. And boom, COVID-19 comes in and disrupts everything and says, you know what, we have to put everything on hold for now. And so we have those number of people waiting for surgery who, you know, which at this time, it's fallen. The numbers, the figures have fallen 60% compared to the same figures last year. The other thing that has been affected as well is chemotherapy. Of course, chemotherapy has also been hit very badly, and over 6,000 fewer people are not receiving their chemotherapy as expected to since the lockdown began, you know. And that is because of various reasons, because we will talk about that a bit later, but because people, this category of people are also people who are very much recognized as the vulnerable category. within all what we've been dealing with this COVID-19. Remember the COVID-19, when it started, we had something called shielding. Shielding was shielding the 65, 70 and above, and also it was shielding anyone with some serious underlying health issue. And some cancers fit that category, but also some of the treatments that some cancer patients are having, some of the anti-cancer treatment is actually affecting and putting them more at risk. So a lot of people, their treatment has been cut short because of that. And it means serious. It means serious issues in the sense your treatment, the hope that you had, the expectation that you had about your treatment has been cut short. And that obviously makes a big impact on how your treatment works and the effect it has on the disease. Radiotherapy also has had disruption, but actually has had the least disruption because the appointments have fallen. But also the real impact of the service is people who might have had certain treatment did not have it, and now they're having some other treatment. And that is all because of the pressure that has the NHS England has faced. The overstretched NHS we know was already struggling, and trying to stay firm on its feet. And then of course we get COVID-19. COVID-19 comes and just overstretches it. And then it has an impact on lack of recovery or intensive care beds. Hence, it had an impact on surgery for people who needed surgery for their cancer. If you reflect on the news, if you've heard on the news, or if you're a healthcare professional, I know people who worked in theater. All the theaters were turned into intensive care units. All the surgical wards were turned into wards for COVID patients. So a lot of changes had to be made drastically to put things in place to accommodate this pandemic. But at which cost? At which cost is what the key problem is. And how do we go forward? What does the road ahead looks like? You know, we've had to have very difficult discussions with patients. We've had to have very, I can't stress it enough, because I don't know if people remember, there was a time when I posted on my Facebook, I said, oh, my brain hurts. It's because of the challenges as a healthcare professional I personally have had to face. I have had to be able to pick up the phone and phone people and say, you cannot go to hospital, because if you go to hospital, A, B, and C can happen. You have to stay home. However, if you stay home, D, E, and F will happen. What would you prefer? For the first time, giving people that onerous burden and responsibility to make a clinical decision based on information that was really difficult to decipher, based on information that was changing on the hour, every hour. Things were changing, guidelines were coming in, policies were being updated. You read the policy, by the time you finish the policy, you get another email, forget about that policy you just read this one again, and so on and so forth. So it's been very challenging. It's been very challenging. And for me, I do get really upset when I hear people make flimsy comments like, oh, these doctors, they don't care. Oh, these nurses, they don't care. They send us to the hospital just so they go and kill us, so we all go and die and get infected. No. All I can say, that is so not right. That is so unfair, and that is so wrong. We are not perfect as healthcare professionals. We don't always get it right. But I think all my years in the NHS, I think it is one of the healthcare services, national healthcare service, that is working tirelessly for the best interest of its population. Its key stakeholders, and its key stakeholders are the patients, are you and me who tap into the services and use it and make it our resources. So it's very, very important for us to think about that. And they're doing everything, we're doing everything to make sure we get back to normality. Some patients are being referred, the private sector has been called in. Where I work, the area where I work, we've got lots of private hospitals and centers. They've all been called in. They are all being used. They're all being utilized. That's where they've been sending a lot of the serious cancer patients so that they don't miss out on their treatment and so on and so forth. So let me just go through some comments and then we'll move on to why cancer patients have become more vulnerable, and they're one of the group of patients who've suffered during this coronavirus time. So lots of good evenings, everybody. What's the age that a man or woman should attain before they receive their initial letter for screening for cancer in the UK? Mr. Tolley, I think it varies depending on the type of cancer. And for example, if it's a woman and it's cervical cancer, then you're looking at ages between 30 to 45. That's the age it affects. So they start asking you for screening just before that. They start asking you for screening. For women, it is usually by the time you're getting to 25, they would have sent you a letter. And following on from that, it is every 3 years between the age of 25 to 49. And then after that, every 5 years between the age of 50 to 64, and then 65 and older, only if one of your 3 last screening was abnormal. So that is it for men. For women, for men, prostate, it is usually they start you on your 40 plus. You start checking yourself, you start making sure you know what you're looking for, and so on and so forth. And then for bowel screening for bowel cancer, you're looking at women and men aged between 60 to 75. That's when they start. But since 2018, there's been a lot of talk, and I think some areas have already started asking men at the age of 50 to start going for their screening. So those are the different ages. For breast is usually offered to women who are about to approach 50 through to their 71st birthday. They're asked to do that. So that, I hope that has answered your question. And I see Nima is also answering that. Harriet says, most NHS patients have been moved to private sector, and guess what? They have few days then sent home. Most breast CA patients will be discharged home with drains, and they will be followed up in the community. Yes, so a lot of the things, so we're kind of in a way, it is sad, Harriet, but we're kind of moving to the way the American system works. Here, I think we do coddle people a lot because our health service is a national health service. In America, when you have surgery such as breast surgery, you're discharged after 3 days, and you go home with all these drains, and then you have the visiting nurses. They call them their visiting nurses. Here we call them district nurses or community nurses. They then come to your house and sort you out. And I think that's the approach, that's the model they're currently using here as an emergency model. So you're being sent home, you're being advised, you're being educated, you're being supported as much as possible. But there's so many Macmillan hotlines in all the different cancer centers that you can call for advice. I think one of the greatest things about cancer, there's advice and resources and support available in abundance. And for my people, I've always said to you, please feel free to use me, to contact me, to tap into my knowledge. I am pleading, I am begging, I am asking, you know, your information will be kept confidential. I don't think I've ever had someone who I've managed or have supported, and I've got plenty of them in the community who would ever put up their hand and say, oh, whatever I told Isatta is out, you know. So please, please, please be assured and be comforted and be confident that if you need help, please give me a shout. I can always signpost you if I don't know what the right information is. I can support you. I can be your appointment buddy, take you to your appointment, whatever you want. I can be a listening ear at your appointments or telephone consultations, because they're doing a lot of telephone and video consultations at the moment. So please, please, you can always, it is your right as a patient and as and your human right for you to say, I need this person to be part of this consultation, especially with the Zooms and the video calls, because it's very important for you to be able to retain that information or refer to that information when you need it. NHS is really under pressure. Indeed, too many changes and very challenging sector. You guys are doing an amazing job. Thank you, thank you, thank you, Ms. B. What is now the intake for cervical cancer among the BAME community? Alima, there's still quite a low intake in terms of the screening. In terms of the diagnosis, it's still one of the top diagnoses in our community. So that is why screening is very, very important. But there's a very low intake in terms of the screening numbers and statistics. So we must encourage our sisters, we must encourage our daughters, we must encourage our friends to go for their cervical screening. It is very, very important. So how often does women need to do their test after their first test at 30 years? Cervical, every 3 years, Mariatu. Every 3 years. Every 3 years you need to do that. So it's very, very important. So why is it that people with cancer have been one of the group of people that have suffered most during this virus? And why have they been considered vulnerable? Well, they've been considered vulnerable because of the treatment they're receiving. Some of the treatment they are receiving makes and puts them at a higher risk of contracting the COVID-19 virus. And some of these people might be having chemotherapy. They might be having another therapy called immunotherapy or antibody treatments for cancer. They might also be people who are having targeted cancer treatment. These are all the various types of cancer treatment, because I know in the common populace, all people know is chemotherapy, surgery, and radiotherapy. But there's so many types and different types of treatment of therapy that are available out there that people have that are receiving cancer, that are receiving, who have been diagnosed of cancer. And some of these targeted cancer treatments can actually affect your immune system. That is why they have been more at risk. People who are having intensive radiotherapy, radical radiotherapy, and that's where they go every day for radiation, every day for radiation. For example, people suffering from lung cancer or people with brain disease, either be it that's where it started, where the cancer started, or that's where it spread to. They're having radical radiotherapy treatment. They are at very high risk. People who are having bone marrow or stem cell transplants and who have had it in the last 6 months. And that is why the Sierra Leone UK COVID-19 team, people are saying, oh, how come you've got all these people? How come you've got, because we've not just focused on the elderly in the SLUK COVID-19 rapid response team. Our focus has not always just been on the elderly. We've also focused on such people who are considered vulnerable. We've got beneficiaries who had transplants under 6 months ago, who they were automatically shielded. And some of those beneficiaries, they've actually been reshielded for another 6 to 12 weeks. We've also got patients, if we just move from the cancer bit, we've also got patients with heart-related problems, people who've had recently pacemakers inserted, and so on and so forth, or had bypass and so on. They're all under the vulnerable category. And that is why these people have been taken more seriously, or they've been told to take this illness more seriously because they are at higher risk. And then the other question I wanted to go through was, does cancer affect the immune system? Cancer itself doesn't affect the immune system because, as you know, the immune system is the body's defense mechanism to fight against bacteria, to fight against viruses, and any other foreign or harmful chemicals that your body gets in contact with. So the blood and the lymphatic system are part of the immune system. So some types of cancers, yes, can affect the immune system. For example, the blood cancers such as your lymphoma and your leukemias, they can affect the immune system because they are blood cancers. They're part of the immune system. And some other cancers that can also affect the immune system, the treatment is basically what really affects the immune system, is the treatments that I've just mentioned, which is like your immunotherapy, your antibody treatment, your chemotherapy, your radiotherapy, and so on and so forth. And so that is why a lot of people, their cancer treatment has been affected. Their cancer treatment has been affected wherein they've not been able to get their treatment because A, it puts them more at risk, B, it makes them more vulnerable. So it is not deliberate. As much as they're slow in putting things back in place, all decisions that have been made have not been deliberate. So I want you to all bear that in mind and think about that when you next have a conversation with somebody who starts throwing blames. It is very important for us to always think, you know, and look at the bigger picture. And oh, Jibril says, thanks for the rapid response, Isatta. I shot through the 40 years age long ago and have yet to receive any letter from my GP for my initial prostate screening. Does that mean the system is failing me? Possibly, yes, but possibly also is because knowing you, traveling from one place to another, maybe they've written lots of letters and they thought you're no longer residing in the UK and so on and so forth. What I advise you to do when things go back to some form of normality, when you can have access to your GP and so on, contact them and put those questions through and say, look, when am I gonna have my screening? When am I having your main screening that you could have is prostate. But prostate sometimes is not readily done depending on your commissioning group, as in your area where you live in. Sometimes you have to have some symptoms before they send you for some screening. But most importantly, I think really you should have your 40 plus check, your 45 plus check, and of course your 50 plus check. So whether it's a screening or not, whether it's just to go and check your blood pressure, your blood sugar level, your height, your weight, your physical activity level, and if you've got other health issues, and most times they also do blood tests just to check your, especially for us, the Afro-Caribbeans, they will check your HbA1c level, which is what monitors your diabetes level. So it's very, very important for you to remind your GP for that, because sometimes it's, again, it's a post-code lottery issue. You're welcome, Iceworry. We're always here to share information and to give information and so on and so forth, so that we can all learn and we can take on board. And also it's to stimulate you as well to go and find more information. It's really about that, because I am not a consultant, I'm not a doctor, but what I can say when it comes to cancer, I'm a specialist. I've studied a lot, I've worked a lot within the sector, and I think I feel quite comfortable and confident to say what I'm saying or read what I'm reading from evidence-based research and say it, repeat it to you guys in a simpler time so that everybody can try and understand rather than the scientific terms and so on and so forth. So really, for people suffering from cancer at the moment, they should be very, very careful. They should look after themselves. They should think about what they're doing, what they're eating, and where they're going. But that should not stop them from contacting their GP, from contacting 111 service if they're in London, or contacting 999 if they need to, or for contacting their key worker in hospital, because every patient who has been diagnosed of cancer would have a named key worker, which is mostly the nurse specialist of that particular type of cancer. If not, most of the hospitals have something they call the Macmillan hotline, which you can call 24/7 to ask for advice and support. So make use of it and do what you have to do to stay safe and be alert and avoid any serious complications. So just to reiterate, coronavirus has in no doubt meant cancer diagnosis and treatment have been put on hold. This pandemic has thrown in our stretched cancer services already. The cancer services was already stressed and it's thrown it into disarray. And many patients have had their treatment rightly stopped because of the immunosuppressive impact, but we are seeing a wider scale of rationing of the cancer services. So it is very, very important for you to stay alert and advocate. If you live with someone who's got cancer, don't just be laid back. This is really what I want. Be proactive, be an advocate, fight for your right, call, ask questions, research, look for answers, and so on. Because this is a time where if you just sit back and say, oh, are they waiting let them call me? They're not they call you, you know. They're not they call you. Are they waiting let them call me? They're not they call you. Because everybody is under so much pressure. It's really about who stands in front of us is who we can see. If you're not in front of us, we can't see you. So you really must phone. You really must ask questions. You really must seek help and make sure you're heard and what is going on with you is being sorted out. Because the hospitals up until 2 weeks ago had become coronavirus hospitals. Everything has been about COVID-19 and cancer patients were no longer priorities. So now we're trying to make some noise. Now the cancer community is saying, okay, we've got this COVID kind of a bit under control with the R test. We're easing down lockdown. How about we start thinking these beautiful Nightingale hospitals, that centers that they open, how about maybe now diverting all the COVID patients to these centers and cleaning our hospitals, creating clean areas within the hospitals. That's what's happening at the moment. It is happening and it's continuing to happen. So please make use of it. Somebody called me today and said, oh, I've been called to go for an appointment in 2 weeks' time. Shall I go? I'm scared. I said, what are you scared of? Oh, well, I said, no. They will take you to a clean area. A lot of the outpatient services are beginning to go back to normal, especially the cancer outpatient services. So please, please, please don't hesitate. Try and get yourself where you're supposed to be, because it is very, very important you don't miss out on your treatment. Yes, to keep everyone safe, they're trying to minimize face-to-face, but they're still doing quite a lot. And they're doing quite a lot of consultations via video calls and via Zooms and so on and so forth. So it's very, very important you think about these things and know what you have to do, because it will cost your life if you don't. It will really, really cost your life. Because remember, screening is very important for early diagnosis. With early diagnosis, you can have treatment as quickly as possible, which means your cancer will be held, and in Creole, then will arrest the cancer and hopefully treat it, and it will go into remission. But if you don't identify it, especially now when the screening services are still on hold, then it's at your own detriment. So please, please, please be vigilant. Yes, Isatta Sisay-Jalloh, you're so right. You have to be your own advocate. You have to be your own advocate, you know, especially us as Sierra Leoneans. We talk and talk and talk, but who say we for talk, we know they talk they. What we for do, we know they do them. So it is very, very, very important that we do this. So somebody, let me just go through, okay, Nima's just answered to that, you know. Say, please contact your GPS. This is where the public community health nurse comes in. Identify the vulnerable population needs, mobilizing with social work, case management, and get available resources to meet their needs at this time. Indeed, but my dear sister, there is so much shortage in terms of all these healthcare professionals that you've called, that is not effectively done. So that is why we have to be our own advocate. So some of the screening that I really want to remind you all of, I know people have already been asking questions, but some of the screening I want to remind you of are really 3 main screenings: your breast, your prostate, your breast, your cervical, and your bowel cancer screening. It's very, very important for you, because those are things you can keep an eye on at home. You don't have to wait for your mammogram to breast screen. You don't have to wait for the stool test for you to check your bowels. You don't have to wait for the smear test for you to start sensing that something is wrong in your cervix. So it's very, very important. The same as the prostate. You don't have to wait for your PSA level blood test for you to know there's a difference or changes in my the way I urinate, and so on and so forth. So cervical cancer, just a quick overview. It's a cancer that mainly affects women between the age of 30 and 45. It develops in a woman's cervix, and the cervix is basically the entrance to the womb from the vagina. So it's like the gatekeeper, and it does sometimes take months for it to be noticed if a cancer cell is developing there, and sometimes when it is identified or diagnosed, it's already advanced, because maybe the person was not paying attention to some of the symptoms that they had been experiencing. Like every other cancer, what are the causes? You have your risk factors, your overweight, your lifestyle, your smoking habit, your alcohol drinking habit, but most importantly for cervical cancer, a virus which they call the HPV virus, the human papilloma virus. That is the virus, a strain just like this naughty COVID. It goes in there and causes trouble. So that is why our young girls are being vaccinated for this, and we are being told to keep an eye, and that is what you go for your smear test for, so that they check if this virus has gone in and created any abnormality. So the cervical smear test is looking for abnormal cells, you know, and that is what it's looking for. And but also the most important thing, when you have your smear test, it's not always because it's abnormal that means it's cancer. No, sometimes it's abnormal because of an infection, and what they tend to do, they'll always retest to make sure it is okay. So very, very important for you to think about that. So what are some of the signs you should be looking for cervical cancer? We're going through this because this week and all this month of June is cervical cancer month. And it's the time to raise awareness. If it wasn't for COVID-19, NHS England, the Cancer Research UK, the Cervical Cancer Organization, they've been banging on every door and every social media about raising awareness, about screening, about diagnosis, about treatment and aftercare. So it's very, very important. So some of the symptoms you should be looking out for whilst we don't have access to screening at the moment is look out for abnormal vaginal bleed. It's not when you're seeing your period, but on random times, and also sometimes bleeding during sex or after sex and in between periods, and also through menopause. If you're someone who's had menopause for years and then all of a sudden you start bleeding, you should be concerned and take that to your doctor. Discomfort or pain during sexual intercourse, again, it might not necessarily be that, but that's one of the symptoms you have to look out for. Unusual and or unpleasant vaginal discharges that are, smelly and so forth. And pain in the lower back or pelvis, again, it's important to keep an eye on that and make sure you follow it through. And like I said earlier on, in terms of ages, people were asking, when do you go for your smear test? You start your smear test just under the age of 25. You usually get your letter 6 months before you turn 25. And then you have your smear test every 3 years between the age of 25 and 49, and every 5 years between the age of 50 to 60. And then when you're 65 and older, you'll only have it once if one of those tests that you've had between the age of 25 and 64 had shown abnormal cells. So that's cervical cancer for you. Exactly. Thank you so much, Isatta. If it's not normal, don't wait. Seek help immediately. Don't push it that it will go away. Don't say it is not my portion, because that's what we do. Everybody, oh, it is not my portion. Back to sender. Back to sender. These diseases, they exist. I keep telling people this because in our community, in our culture, we believe in voodoo, black magic, superstition, and so on and so forth. Now, me stepmama don't do me mama will born me, not like me anymore. Now, I don't care me go. They don't go shoot me with witch gun. I dream them bet me Bobby, and so on and so forth. But sit back, especially us in the diaspora. Sit back. I'm sure each and every one of you who listen or watch this program have visited someone in hospital. Are all the people in hospital who are non-Africans, why are they being diagnosed of all these health issues? Then self get a stepmama will not like them. Then self get stepsister will not like them. Then self get somebody who hates them. Then self get mate, and so on and so forth. It is very important we pay attention to these things and do what we have to do. So let's move on to breast screening. Again, breast cancer is one of the top cancers for women, and 1 in 8 women in the UK are diagnosed with breast cancer during their lifetime. So it's very, very important we pay attention to it and look after ourselves by doing breast self-examination. Breast self-examination is basically where you put your hand on your head, you use your 4 fingers like this, you start from your nipple, and then you start going around and checking your breast. You check the lymph nodes on the knee here, you check your shoulder here for any lymph nodes, and all the way here, and you go around your breast and so on. And what you're checking for abnormal tenderness, pain, unnecessary fluid or discharge coming from the nipple, soreness, or any lumps, and so on and so forth. That is what you're checking for. And in this country, breast screening, which is the mammogram, which is extremely uncomfortable, they started at the age of 50 up to the age of 71 when you have your 71st birthday. So it's very, very important you do that. But at the moment, under 50 can have breast cancer. So don't wait, don't say, oh, I'm not 50 yet, so I shouldn't be checking my breast. I've come across people who are 29, they've had breast cancer. Usually they say 30 and above, but I've come across people like that. So please, please check yourself. Make sure you do what you're supposed to do and do your own screening. Do it in the shower, do it when you're laying flat, get your husband or your partner to check it, and so on and so forth, and to help. The other one we have to look at as well, we have to keep an eye on, is bowel screening. Bowel screening is all to do with keeping an eye on for bowel cancer. What is bowel cancer? Bowel cancer is basically cancer of the colon, which is the large bowel. So any cancer that you have in your colon or your rectal area is usually referred to as bowel cancer. And again, it is a cancer, if caught quickly, it can be treated and you can go back to normality. But if it's not, it can be very serious and life-threatening and limiting. So what are the three main things for you to look out for whilst you're waiting for a screening? Or what are the three main things sometimes when you pick up on them, you have to go and seek help so that you can have further investigation and screening. Persistent blood in your toilet, when you go toilet, very important for you for watch. Some people them, you say, oh, me, I know they watch me toilet. There's nothing wrong for let you watch your toilet. The same way where you watch you piss. Where you go toilet, before you flush, where you wipe your waist, it's always important for look that tissue there and see what's in the day. Where you wet, look the piece, make you see the color, make you see what's in the inside there. Because even though now flush toilet we do, if you piss, then you get beaucoup debris inside. There's something wrong. You need to go check yourself. If you don't go toilet, then you see blood inside, and you know to possibly get hemorrhage, the thing what they call pile, then there's something wrong. You need to check it. It might not be a cancer, but it might be other things like ulcerative colitis or duodenal cancer, ulcer, and so on and so forth. So it's very, very important. The other thing where you have to keep an eye on as well is a persistent change in your bowel habit. If you're not somebody who don't use for go toilet every morning, then all of a sudden now you go morning, Sunday, evening, and you not change your diet at all. Not to say you eat boku pepper when you not use for eat pepper, or you go eat something where they make you belly run, or so on and so forth, or you not take laxative, then all of a sudden your bowel habit change. You need to keep an eye on that. And then also you get lower and persistent abdominal pain where your bottom belly they hurt you persistently, or you they feel like say somebody don't pump breeze now your belly, or you they feel uncomfortable. Again, those are symptoms for keep an eye out with. For women, and sometimes this is a symptom way similar to, for some people them premenstrual. So women and they before them see them period, then you feel like say somebody don't pack wind in their belly, they feel some sort of discomfort, and then they feel lower abdominal pain, bottom belly pain. But again, if not for premenstrual, it go down as soon as you begin see period or after you see period. But for this kind of issues, sometimes they go away. So that is what you need to keep an eye on for. Yes, because of resources, because of how things are, they always can try to get a targeted population. And so with bowel cancer, the screening, then they target them every 2 years to men and women who are aged 60 to 74. But like I say, NHS England, the ministers and so on in House of Parliament, they go on and on about the future of bowel cancer in 2018, and Public Health England and NHS England, they don't decide say they will start for do screening from the age of 50. So if you might be lucky that you didn't have an area where they already begin to that. Some areas they not do that again. Yeah. So again, those are some of the things you can able to do for yourself where you didn't, especially at this unprecedented time. Of course, if you notice anything, then you take them to your GP. Then they will take them a step forward where they will begin send you for things like fecal test, where basically that they test your stool for more blood and see, or then do something that they call bowel scope, where basically they put a camera through your bottom for see waiting day inside day, or then can put a camera through your mouth to go down like the top half of your gut for see waiting day inside day. So those are the things that they can do for further investigation. Of course, your blood test now, and of course, scan, CT scan, MRI, PET scan, and so on and so forth. The other thing, the other screening as well, where they but is not that popular right now, now prostate cancer screening. Like Mr. Tolibi they asked earlier on, it is basically that they start for doing now from them and 45 and above, to keep an eye on people them, especially the BAME community. We the Black and ethnic minority community, two of these cancers we they get lots of them: cervical and prostate. So we very, very much careful, be vigilant, and do what you're supposed to do for look after we step. With prostate, you they able feel your prostate when you put your finger and your back passage and your anus, basically. You they able feel your prostate, because it's don't just right there between the urethra and that passage. So you they able feel you they able know if it big too much or not big, or it painful, and so on and so forth. But one of the ways where man that they able notice is urinary infrequency. Basically, where you they try for pass urine, you they pass small, then you stop, but still you they feel for go, then you begin again, then you stop, then you begin now so normal, or you they piss fast, and so on and so forth. So those are the kind of things you get for look out for. And for that, the official screening where they get blood tests where they do, where they check for your PSA level, which is basically a prostate specific antigen where they look for, and then you get the digital rectal examination where the GP they basically put a glove on, put some lubricant, and stick their finger down the backside or check waiting they go on and waiting not they go on. So basically, these are all the screening tests that are available, but at the moment they are not. They are on hold because of this COVID-19 virus. So in the meantime, you can go and keep an eye on yourself, check out for some of these symptoms, and make sure you do stuff. And yes, Auntie Betty, Bowel Cancer Society can post routine stool testing kits to homes of citizens 60 plus. People shouldn't ignore it. Oh yes, they do. And there's so much, for us in the diaspora, we're extremely lucky. A lot of these services are available. They are available at our fingertips, especially for us in this UK. Because when you compare our brothers and sisters who live in the United States, some of them don't have health insurance to go through some of these treatments. But for we, Naya, as much as it's not a free service, in inverted comma, it's a free service, because we pay for it through our taxes, we pay for it through our national insurance contribution. So please, make use of it, take advantage of it, and be your own police. Be your own police and look after your health and look after your well-being. Yes, also loss of appetite and feeling full at all times, absolutely, and also drastic weight loss. Those are all things you should be looking for. And yes, stop dumping and flushing immediately. Watch at least once a week. Yes, watch at least. Exactly, my sister. If not a witch gone, now fange, my people don't die from something that you could have been saved from. There is help, and prognosis will be positive if detected early. Of course, early detection saves lives. So it's very, very important for us to do all these things and make sure we're doing what we're doing. So thank you so much. Thank you, Martha. We need this health talk. I'm back. It's been a while, and I missed this, and I'm glad I'm back and doing what I'm doing. So it's been very, very, very great. We're gonna log off in a minute, because I think it's nearly 10 o'clock. As you know, the new norm, we're now doing all this from home, in our own homes. We can't go to the studio anymore, and so on and so forth. So it's been great having you all. I really, really appreciate it. And I hope you continue to listen. I hope you've learned one or two things from what I've said. I have definitely learned. It's been interactive, and I'm forever grateful. If you know someone who needs help, push them, urge them to seek help and support, because it's very, very important, and encourage them. I know we always think if we don't talk about the problem, that means it will go away and it's not happening. But it doesn't happen like that. So please let us take heed and look after ourselves. Be our own police, be our own advocate, be our own vigilante, and do what we have to do. Because it's very, very important for us to stay safe, stay alert, and look after our health. So thank you so much. I thank you all, and I hope you enjoy the rest of the week and the weekend. Want to say thank you, but also just to remind you all, the Sierra Leone UK COVID-19 Rapid Response Team is still going on. Yes, we're winding down as the lockdown eases as well. So we will come with some updates soon in the next week or so to remind you of what's going on, what we've done so far, and what the plan is going forward. But it will be coming to an end, because to some extent, as much as we haven't eradicated the virus, we are adapting to a new norm, and people are now beginning to go out and get access to their basic needs and essentials. So thank you so much, and have a blessed evening. Our producer, are we going off in a minute?